This is Dr. Jeff Ullery from Whole Body Health, and today what we're doing is talking about and teaching about Gua Sha. Gua Sha is a Chinese medicine technique or therapy that you can use to work on all sorts of health issues. It's been around for over 2,000 years. Quite honestly, from my understanding, if you look in a medicine cabinet or first aid kit, and many people in the Orient, they'll have a Gua Sha tool available. And so the focus when we do Gua Sha in my office is to treat muscles or tissue that needs release, like scar tissue or muscle spasms, muscle strains. The term Gua Sha in a translation from Chinese means scraping. So the Gua Sha tool is also translated to scraping tool. It can also be called spooning, coining. There's all sorts of phrases people use to describe it, and basically what we're trying to do is release tissue. So like I said, the Gua Sha tool or the Gua Sha technique is used in the Orient and for many health issues, most frequently for muscle strains, but it can also be used for respiratory issues. And I will do future videos for technique over certain areas of the body: shoulders, elbows, knees, thighs, etc., neck. And so we'll break each one of those techniques down and just showing how to do the technique, or at least how I do the technique, so that you can use this at your own on your own time to treat yourself or your family or friends. So just a simple example, this would be one version of a Gua Sha tool. It's got a rounded edge where there's no seam. We can use actually something that is specifically made for Gua Sha. Many people will use utensils. This is a fork, couldn't find a spoon, but the edge is rounded, and so you can actually use this as well. Many people think that one of the tools that I have looks like a knife. This is a Gua Sha tool as well. This is a butter knife. I would never use the edge of the cutting surface or the back of the cutting surface, but if you have a nice rounded edge on the knife, you could actually use that as well. So I prefer to use the tools themselves instead of utensils, but you can do whatever you like. The other part is you always want to make sure you have some kind of lubricant. I apply the lubricant over the tissue. This is one area that I work on myself a lot because of my just the amount that I use my hands and arms in practice, and the amount that I used my arms and hands when I was playing football has created a lot of scar tissue and trauma in my wrists and around my thumb. And so I also had surgery on this thumb. So this is the area right here on the thumb where I have scar tissue. I had surgery on this thumb. And so what I'm going to do is I'll just apply some lubricant to the area, and then it's as easy as just scraping. I'm not putting a ton of pressure on this. I'm not trying to create pain. What I'm trying to do is just create some sensation of scraping. And so I put the Gua Sha tool at an angle, and I put a little bit of pressure, and then as I return to the starting point, I can either slide across the tissue or I can lift and come back. I like to slide across the tissue. And what I'm feeling for, the question is, how do I know if I'm doing it right? One of the ways that you know you're doing it right is when you slide across the tissue, it almost feels like there's sandpaper under the tissue. It's got this gritty, crunchy feeling to it. And so what I'll do oftentimes is I'll slide it one way, and when I slide the tool towards the camera, it is actually pretty smooth. But when I slide the tool the opposite direction, it feels like I'm sliding over pebbles or sandpaper or gristle. And so I'll just work that tissue until it starts to feel better, or there's less crunch or gristle or sandpaper sensation to it. And so, like I said, I don't have to do this really super hard. I'm sitting here, I'm performing the technique as I'm talking to you. Excuse me. I can also perform the technique while watching TV or listening to a book or talking to my family. The other thing that I would like to point out is, because of what we're doing, it'll create some redness, and sometimes the redness will be very dark, and sometimes it'll also bruise. The bruising, the the redness from the bruising is called petechiae, and it's actually what you're doing is you're breaking up tissue and you're breaking up fascia within the tissue, and it's actually going to increase range of motion, increase function of the muscles, and increase and hopefully decrease pain if you're having pain in that area. So it looks like it hurts when somebody has it done and it leaves a lot of bruising. It can look from the observer like it was very, very painful, but it's almost never painful. It just always looks worse than it is. And so, and oftentimes the bruising will provide the most therapeutic effect. If it's bruising, people will tend to feel like they've really gotten some benefit from the technique itself. So check into our future videos on Gua Sha. I'll go over how to perform it specifically and what you're doing when you perform it, and then we'll go over the different regions of the body as you join us in the future. So thanks for joining us. Have a great day.